Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Federal government receives 177,600 doses of the Johnson & Johnson vaccine. Lagos State fully activates 10 oxygen treatment centers and more sample collection sites. And UAE government says over 42,000 vaccine doses have been administered in the last 24 hours. Nigeria recorded 790 cases of COVID-19 with one death, the highest in 6 months. The Nigeria Center for Disease Control, NCDC's latest report shows the cases were recorded in 13 states, with Lagos, the epicenter of the outbreak, taking the lead with 574 cases, followed by Rivers, which recorded 83 cases, and Ondo, 38 cases. Let's take a look at the update.
Daily COVID infections in Nigeria has surged to the highest in recent times, fueled by the Delta variant. However, the figure witnessed a jump in the last 24 hours. The latest figures coming from the Nigeria Center for Disease Control are 790 confirmed cases reported from 12 states and the FCT. Lagos had the highest number of infections with 574, followed by Rivers with 83, Ondo reported 38, Ogun registered 31, while Oyo reported 23. Delta recorded 10, 9 were registered in the FCT, 7 were reported in Ekiti. Edo had 6, Osun 4, Anambra and Bayelsa registered 2 cases each, while Plateau had 1. There were 0 cases reported from Kano, Nasarawa, and Sokoto. Nigeria now has a total of 179,908 cases. There have been 72 discharged in the last 24 hours, increasing the total number of recoveries to 166,203. The NCDC also reported 1 additional death from COVID causes in the last 24 hours, raising the fatality toll to 2,195. Presently, there are now more than 11,000 active cases in Nigeria, while over 2.5 million samples have been tested so far. In Africa, there are over 7.1 million cases and more than 179,000 deaths have been recorded across countries on the continent. The total global confirmed cases have now surpassed 204 million, while more than 4.3 million deaths have been reported.
The federal government has received a first tranche of the Johnson & Johnson COVID-19 vaccine, totaling 177,600 doses. The government says hard-to-reach populations and security-compromised communities will be targeted with these vaccines. The executive director of the National Primary Healthcare Development Agency says the shipment is part of a 29.8 million doses of the J&J vaccine procured by the government through the African Vaccine Acquisition Trust, AVAT. According to him, Nigeria hopes to get up to 50 million doses of J&J vaccines by the end of this year.
Because it is a one-dose effective vaccine, these doses will be focused on those who are in the hard-to-reach areas. That is to say, the riverine areas, desert communities, security-compromised areas, and also the elderly. This is because these are the people who may find it difficult to leave their homes to the health facility for the second dose after taking a first one. So we're going to be optimizing these doses that we've received for these people that are usually vulnerable and live in the most hard-to-reach areas. The balance of the vaccines will be delivered over the coming months, but we're glad to hear that before the end of August, the total quantity of vaccine that we'll be receiving is 173,132. We have the capacity to store and distribute this vaccine all the way to the point of administration, as we have working freezers in all 36 states plus the Federal Capital Territory. The Johnson & Johnson vaccine is stored at temperatures of +2 degrees Celsius to +8 degrees Celsius, which is the temperature in which most of our routine immunization vaccines are stored. The availability of different vaccine brands does not in any way mean that some categories of people are being selected for high-quality vaccines, while others are targeted for low-quality vaccines. All COVID-19 vaccines approved by the World Health Organization and NAFDAC are safe and can deliver adequate protection against COVID-19 against COVID-19.
Nigeria is not yet at the threat level to consider another COVID lockdown. This is coming from the Minister of Health, Dr. Sage Haniwe, who disclosed this during the weekly ministerial briefing at the State House. According to him, in spite of the number of cases of the Delta variant now pegged at 76 out of those sequenced, the country has not yet attained a level that would warrant the consideration of a lockdown. On vaccines, the minister assures that those who have taken the first shot of the AstraZeneca vaccine will get a second dose by month end, when 3.9 million doses of the AstraZeneca is expected to arrive the country. Meanwhile, on other health issues, the director of the Nigeria Center for Disease Control, Dr. Chikwe Hekwazu, says that between January and August, over 31,000 suspected cases of cholera have been recorded, with 816 deaths reported from 22 states and the FCT. A public health expert from the University of Benin Teaching Hospital, Edo State, is warning against combining different brands of COVID-19 vaccines available in the country when receiving their first and second shots of the vaccines. Dr. Greg Okobo explains that over 20,000 Edo residents who received the AstraZeneca brand of COVID-19 in their first dose should wait patiently for the next supply of the AstraZeneca vaccines to complete the doses. He was speaking after the Edo COVID-19 response team inspected facilities at the state's primary health care development agency, where the state governor also confirmed that the state will receive the Moderna vaccines by this weekend.
We know that the Delta variant is already here with us in Nigeria, and we are beginning to witness an increase in COVID cases. So this visit is to just check our response arrangements, to check our emergency operations facilities, which we used for the first and second wave of COVID, to make sure that they're in shape and they're ready for the response which we are currently planning for the third wave. We are receiving some Moderna vaccines this weekend, and so this visit is in preparation for receiving and ensuring that we have the processes in place to deliver the vaccines to those citizens.
The science is that you cannot take the two together. If you've taken AstraZeneca first dose, you have to take the AstraZeneca second dose. If you take the Moderna first dose, you have to take the Moderna second dose. You can't take AstraZeneca first dose and Moderna as second dose. And that's why the state government, as well as the federal government, have tried to ensure that we have doses of each of them, so that those who took the first of any of the vaccines can have a second dose.
And one of the most disturbing challenges in the control of the spread of COVID-19 in Nigeria is arguably non-compliance to the safety measures outlined by the NCDC, a situation which appears to be basically the same across the country. In this next report, we're examining the rise in cases in Akwa Ibom State and the reasons for non-compliance.
The emergence of the third wave of COVID-19 pandemic in Nigeria has led to an increase in cases driven by the Delta variant. Owing to this, Akwa Ibom has since witnessed a rise in the number of infections and reported 3 deaths in the last month.
Our invitation to people, availability of excellent PCR laboratories, and these free services have been a great additional attraction to the high turnout of people, especially from our neighboring states, to test and receive free treatment here. As the names and the addresses in our test list have shown, they certainly account for the high numbers of cases we are recording in our state in this new wave.
The situation is the same like in most parts of the country, as most residents are seen not adhering to the NCDC safety guidelines. A psychologist at the University of Uyo reels out some factors that may be responsible for non-compliance.
What we should do about COVID-19 and for people to adhere to it? Yes, it's a good question, very timely question. But then we cannot build our houses in the air. There must be a foundation. There must be something in place that these things would be, the new ideas will be built on. Government should even produce this for you to know that government is serious. For the citizens to take this case serious, very seriously, it should be demonstrated by the government.
The Akwa Ibom government says all COVID-19 monitoring mechanisms have been reactivated to ensure strict compliance with guidelines and protocols to assist the state in curbing the third wave.
And Dr. Kamene Udo is the Senior Registrar, Department of Pediatrics, University of Uyo Teaching Hospital, Uyo. He joins us virtually for more on the situation there. Thank you for joining us on the program. I'd like to get your thoughts on why you think there is a surge in cases, and what's really happening in Akwa Ibom.
Well, thank you for having me online this evening. The rising cases of COVID-19 in Akwa Ibom State could be attributed to, we know Akwa Ibom State is one state that has 2 molecular labs for testing of COVID-19. We have Akwa Ibom State's molecular laboratory diagnostic lab at Itumba, world-class built by the state governor. We also have a PCR in the University of Uyo Teaching Hospital. So because we have been testing a lot of people, and the tests are free in Akwa Ibom State, we have a lot of people coming in to have tests carried out on them. So that could attribute to the rising cases of COVID-19 in Akwa Ibom State. However, I also know that the current variant here, Delta variant, is highly transmissible. It spreads faster. So that also could also be the reason why we're having high cases of COVID-19. But by and large, I think because Akwa Ibom State is testing a lot of people, and they are not paid for it, that the test here is free. So that could be the reason why we're having an increased number of cases.
Dr. Udo, yes, tell us about children. Are they presenting with COVID-19? Have there been cases in your hospital? And what are the symptoms?
Yeah, as we all know that the rate of infections of COVID-19 among children is not very high when you compare to adults. But we have been seeing increasing number of children with COVID-19. It will interest you to know that they present just like any other upper respiratory infections, malaria, cough, fast breathing, weakness. So it's just like every other upper respiratory infection, or even vomiting and loss of appetite. But it's just when you have a high index of suspicions and you go into testing it and you discover that they are positive to COVID-19. So we have a few cases of children being infected with COVID-19, and however, the cases are not severe in children. Of course, there are so many theories that will account for that. The malaria endemicity in children in this area, also maybe the issue of that previous use of anti-malaria can be why we are not seeing high cases of COVID-19 among children. But by and large, we still have children coming down with COVID-19, and they present like upper respiratory infection.
Finally, what is your advice? How do you separate COVID-19 symptoms from perhaps any other common cold or other ailment? What's your advice to parents or guardians?
Well, it all starts with high index of suspicions, a good history, where the person is coming from. Of course, where the person is coming from is not even more important these days. But when you see a child present to your facility with cough, fever, fast breathing, and maybe weakness, is important. You do COVID-19 screening test for such a child. Perhaps it may turn out to be COVID-19 positive. So it's just that you need high index of suspicion. Of course, with the availability of PCR lab in University of Uyo Teaching Hospital, also with the state's molecular lab, we can do this test free of charge for children and even for adults. So when you suspect it, you go in and do the test and advise the parents about COVID-19 protocol so that you further limit the spread of COVID-19.
We appreciate your time. Thank you so much. Dr. Ekemene Udo is the Senior Registrar, Department of Pediatrics, University of Uyo Teaching Hospital. Thank you for joining us on the program.
Thank you for having me on there.
Still ahead, 72.68% of UAE's eligible population have been fully vaccinated. We have more on that story in a moment. Welcome back. The Lagos State government has fully activated 10 COVID oxygen treatment centres as well as 20 local government areas where COVID-19 sample collection will take place in the state. In a statement made available to Channels Television, the State Commissioner for Health, Professor Akin Bayomi, says the centres, which were established at the height of the first and second wave of the pandemic, have been reinvigorated to provide swift oxygen therapy and easy access to COVID testing for citizens who care to test for COVID-19. The 10 COVID oxygen treatment and sample collection centres are community-based and established as dual-purpose facilities in the 10 local government areas with high burden of COVID cases. According to the Health Commissioner, these sample collection sites are operated by medical officers of health in each of the 20 local government areas and supervised by the Lagos State Primary Healthcare Board in collaboration with the Lagos State Biobank to increase ease of access of residents to testing. The United Arab Emirates today announced over 42,000 doses have been administered in the last 24 hours, bringing its total vaccine doses to over 17 million. This figure represents 72.68% of its total eligible population that has received the full dose and 81.67% that have received one dose of the COVID vaccine. In this next report, our correspondent Maiwa Degoke will learn more about one of the UAE's homegrown solution, which has helped it to top the global vaccination ranking.
Less than 30% of the world population has been fully vaccinated. With many countries catering to local needs first, low-income countries are at a higher risk, making vaccines the most sought-after product globally. Various countries with the means are developing solutions to a global pandemic that's approaching its second year. In the UAE, Hope Consortium, a partnership between Abu Dhabi government as well as other private entities, is one of the country's solutions.
COVID is an extraordinary situation, so we needed an extraordinary solution, an approach to this.
There are so many different vaccines that you store in different temperatures.
This facility in Kizad has the capacity to house 11.5 million doses in a freezer farm, and in other rooms, 1.2 million vials.
Every vaccine that's at risk is a life at risk. So our challenges are to make sure that we have the foresight to be able to see those challenges and have mitigation plans in place to address them.
In the control tower, the movement of vaccines in remotely controlled trucks is monitored. This is to ensure the integrity of the cargo, which can only be opened at the point of delivery. Another partner is using blockchain technology to secure relevant data, ensuring its integrity despite being globally accessible.
For example, if it is Pfizer, Moderna, whatsoever the vaccine, they have to initiate that, yes, we have put these number of vaccines, these number of doses, and these are the barcodes. So it's in a secure database. For me, as a receiver, as a country, let's say UAE, I have to make sure that, yes, these barcodes are there, these are the vaccines, and everything is right.
VA Medica has helped to provide medical manpower for the administration of vaccines across the UAE, which ranks highly for speed of vaccination.
The concept that we follow is rather to bring the vaccine to the people, not having centralized vaccine stations, and sometimes it's very difficult for people to get to certain locations. So with our tented clinic setups, we move those clinics to the dedicated areas. We then do a bit of public awareness together with your local government on the vaccine process, as well as the benefits of the vaccine. And then our medical teams and administrative teams do the necessary follow-up.
Hope Consortium says it is ready to partner with any country in need of assistance, But first, the vaccines need to be available. From here at the Abu Dhabi port, Mayowa Adegoke for Channels Television News.
And our Dubai correspondent Maya Adegoke joins us now from Dubai. Thanks, Maya. It's interesting to see the process the vaccine goes through and, how it gets to the final port or final consumers. But, I mean, with the high speed that the UAE is vaccinating and some of the solutions available to the country, are infections and hospitalizations dropping?
Well, Millicent, it's interesting that you asked that question. I'll give you sort of a picture to help you understand where we are at this point. Remember the last time we spoke about this, I did tell you that we were in the 1,500 range. Now, mid-June, we recorded about 2,000 new cases. Today, we had 1,200. So between that 2,000 mid-June, the 1,500 that we had been getting over the past couple of months, and then 1,200 today, that's definitely an interesting drop. We will keep our eyes on the figures to see if it keeps dropping or if it stays at the same level. So I think that that drop that we saw just in the last 24 hours is quite interesting. We hadn't seen that kind of drop in a while, and we'll be looking to see how it progresses going forward.
What is the rate of vaccination of students and academic staff in all the Emirates? Because it appears there's been a major breakout of cases in some other countries like the US, witnessing a surge in children getting infected.
Well, children are out of school at the moment, and I can tell you that teachers are already vaccinated. I remember speaking to a couple of teachers earlier on, and some of them, hesitated. They're like, well, I don't really want to take it. But at this point, I have to, because the system is now designed that teachers will have to be vaccinated because of how sensitive the job is. So teachers are vaccinated. Students age 16 and above will need to be vaccinated if they are to resume school in person by the end of the month. And then the government is also pushing for children to resume in-person schooling. Previously, what we had seen was a hybrid system where people would do a week in, a week out. But at this point, when school does resume, in about a week from now, parents will need to decide if they want their kids to school in person or if they would rather be on the distant learning program. And now what I hear is you would need to choose. Previously, when we had the 1 week in, 1 week out, now you can't do that anymore. You will need to decide if you want your child to school in person or if they would school via distance learning. And you would need to maintain that for the whole session.
All right. I must quickly ask you, finally, Maya, and this is as regards travel, what is the latest? I mean, can I come and visit you in Dubai now?
Unfortunately, Millicent, because you're not a resident, you would still need to go stay somewhere else for 14 days before you'd be allowed into Dubai. We really do hope that situation changes, and it's quite interesting because a lot of people say that, oh, when the expo comes even closer, the situation might change. But hey, this is August already. The expo kicks off October 1st. In short, the opening ceremony kicks off last day of September, and that's next month. So keep our eyes peeled. I was on the phone yesterday with an official in the embassy, and he told me that they are aware that Emirates has applied to the Nigerian Aviation Authority, and we would see if that permit will be granted so that they can now start flying. I believe that if that permit is given, if the Nigerian government says, okay, go ahead, things might then escalate a lot faster on the positive side. But trust me, I also want to see you, Millicent, very soon.
All right, Maya, always a pleasure. Thanks again for that update. Our Dubai correspondent, Maya Adegoke there. In Germany, well, authorities north of the country say more than 8,000 people need to repeat their COVID vaccinations as they may have been injected with saline instead. Police are investigating a nurse's actions at a vaccination center in Friesland near the North Sea coast. The nurse had admitted in April to giving saline to 6 people to cover up the fact that she had dropped a vaccine vial on the floor.
Initially, only 6 people were believed to have received a harmless salt solution in Fire's Land in March and April. Many of those affected were aged over 70, a high-risk group in the pandemic. The 40-year-old nurse had been sharing corona-critical information on social media, criticizing the government restrictions aimed at curbing the virus spread, says authorities. Police are not ruling out that a political motive could have prompted the nurse's action, though her lawyers have rejected that and also dispute the skill of the saline swab. Over in China, a woman diagnosed with COVID-19 has given birth to triplets, the first case of its kind in the country. The 29-year-old mother was diagnosed with coronavirus in early July at 28 weeks into her pregnancy and was admitted to the Ruli Day Hospital of Traditional Chinese Medicine, the designated hospital for treating COVID-19 patients. A medical team consisting of 32 leading doctors from the state, provincial and municipal levels were rushed to Ruli and customized a treatment plan for her while preventing premature birth.
Stay safe and continue to take responsibility. You can take a look at our website with the latest updates, a better understanding of the pandemic. You can find them there. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay safe and healthy.